Hello, I'm Kate Seaton-Jones, Medical Director at Phyllis Tuckwell. We've been delivering excellent hospice care for nearly 40 years and continue to improve. We have achieved much over the last 3 years and have a clear vision for the future, as this patient scenario shows. So let's meet Maggie and consider how our care for Maggie and her family would have improved over the 6-year period. She has been diagnosed with a brain tumour. She wants to be cared for at home, but is worried about how this will affect her husband and children.
Back in 2013, Maggie's GP would have been unsure whether to refer her to the hospice or the Beacon service.
Moving on 3 years to 2016, with the hospice and Beacon service combined, the GP had one easy-to-access end-of-life care service.
And our vision for 2019 is exciting. GPs will be clear about referral as Phyllis Tuckwell's service will be much more joined up with other NHS services.
In 2013, a CNS visited Maggie to advise her on the support available to her and her family, but the various services all seemed a bit disjointed.
By 2016, the CNS was the prime contact, providing access to all services.
In 2019, the CNS will be much more influential, coordinating the care of patients between the different healthcare agencies.
One bank holiday, Maggie suffered a crisis with uncontrollable pain. In 2013, our limited service couldn't get out to see her, so she had to go to hospital. Not where she wanted to be. Maggie also investigated the different care home options for when she came out of hospital, but they didn't really know how to support her.
By 2016, we were able to help Maggie through her crisis and keep her at home. When looking at the alternatives, she was impressed by the care homes where Phyllis Tuckwell had provided staff training, but Maggie preferred to stay at home, supported by the Phyllis Tuckwell team. We also arranged therapies for her. Hospice Home Support had joined Phyllis Tuckwell, so trained volunteers helped in practical ways such as with shopping. The NHS community nursing team worked closely with our hospice care at home team and other healthcare professionals to support Maggie at home, valuing the expertise of the Phyllis Tuckwell community team in end-of-life care.
By 2019, the hospice care at home team will include more night nursing, enabling Maggie to stay at home. More community nurses will be trained in end-of-life care issues by Phyllis Tuckwell's clinical team and will be more confident. New technology will enable Maggie to talk with a CNS via a video phone or TV for quick consultations in between her visits. And more care home staff will be fully trained by Phyllis Tuckwell, giving increased support and reassurance if she chooses to go into a care home.
In 2013, after going to hospital, Maggie was admitted to the IPU, but had to wait until Monday because weekend and bank holiday admissions were not routinely available. She couldn't stay in the IPU, but because her husband couldn't cope at home, she had to move into a care home. Her condition worsened and she was moved to hospital, where she died.
In 2016, Maggie was lucky to be transferred to the IPU over the bank holiday weekend, as referrals over weekends and bank holidays were dependent on whether a doctor was available. She returned home, where she later died.
In 2019, our Rapid Response Service, 77, will mean that complex problems can be dealt with immediately, not delayed to the next working day, and she can be admitted to the IPU any day of the week, even on a bank holiday or weekend. The improved service means it's more likely that Maggie will be able to die at home, where she wants to be.
In 2013, her husband was offered one-to-one support throughout Maggie's illness and into bereavement, but he would have preferred more informal group sessions. There wasn't much support for the children.
By 2016, Maggie's family were well supported throughout. Her husband particularly valued the informal coffee morning bereavement support and joined Breeze, a group for single parents, where he met others in the same situation. The children were supported with Little Rays and Storm groups and one-to-one counselling.
By 2019, Maggie's children and husband will have even more support as additional groups will be developed and individual counselling improved.
These exciting developments take us from excellent to even better. A clearer referral procedure, more joined up with other NHS services, admissions to the inpatient unit on any day of the week, night nursing care in the community as well as on the inpatient unit, community nurses and care homes with staff who are better trained in end-of-life care, increased therapy services in the community, and better bereavement support for all. We are caring for more people with more services than ever before, and we will continue to improve and develop over the next 3 years and after.